Hey y'all, we're at part 4 of the series, polyneuropathy of the peripheral nerves. Yes, I have on the same clothes. We're just recording right along from the last video. So in this part of the series, we're going to talk about from our abdominal area on down to our feet. So I have to make this disclaimer. Some of this information may not be what you want to hear. You may not want your children to hear it. I don't know, but it is what I went through, so I have to discuss it so that if someone else has these problems, they won't be ashamed of it and they will discuss it with their doctors or whomever they need to discuss it with. So when I started this process in 2003, like I said in my previous video, I went numb, sort of slightly numb, not completely numb. I would say maybe 40% numb on from my right breast area all the way down to my foot. So it was like it made a straight line through the middle of my body all the way down. So my left side wasn't affected. The left side of my abdominal area was not affected. Y'all, I'm sorry. My Ring doorbell is just chiming when people go by, so I apologize for that. But my left side was not affected. I had no problems with my arm. My right side, my left side from the breast all the way down to my toes. I had no problems. But when you went straight down the body, that's when you went into the vaginal area. So I had no sensation, no sexual sensations. I had none whatsoever because it's like I said, I went numb from my chest area, all my sternum, all the way down, straight down. So it's like it cut it in half. And one half didn't work, the other half didn't work. So I dealt with that. I went to a doctor. They couldn't do anything. They gave me some, I can't remember what the medication was to try to help with that, but it didn't help. So I just learned to deal with it. I didn't have any sensation. There was no, the O word, didn't have those. It just was what it was. So now the pain and the numbness from my left leg on down, I started having problems with a sciatic nerve. And if you know your sciatic nerve, it runs from your lower back and it can go all the way down the back of your leg to about mid-thigh area. So I had that pain, and that pain can be debilitating all in its own. So you have problems with walking, and sometimes I had problems sitting. So I had to kind of lean to the side to get pressure off of that side. But I dealt with that. They started me on some different meds like gabapentin. I had to stop the gabapentin because it caused me to have hallucinations. Not saying it's going to happen to you. And then I was on Lyrica, Cymbalta. I had to stop the Cymbalta because I developed hepatitis. Hepatitis is an inflammation of the liver. Some people get confused when you say hepatitis. They think either A, B, or C, and they really think C, which is the one that comes from contact with blood products when you using someone's toothbrush, using someone's razors. If they have hepatitis, it can be passed that way. Hepatitis A is for when people work in the food industry and they go and use the restroom, don't clean their hands, come back, deal with your food, pass it on to you. So I didn't have any of that. I just had the inflammation of my liver. My eyes were yellow. I was jaundiced. I was really, really tired, really, really fatigued. I was at work, couldn't stay awake. And so finally I went to the hospital and my liver enzymes were out of the roof. I wound up staying in the hospital for 5 days until they got that under control. So I had to get off of that medication. And then I started having these tingling sensations in my lower leg. Now, this leg, my right leg, has been giving me problems since this all began. Like I told you, I wasn't able to kind of walk because this leg was so numb. But the feelings came back. I started to develop foot drop. So with foot drop, your foot is on a level like this. But with foot drop, your toes kind of bend So when you walk, you have to lift those toes up. So if not, you will drag them and you can trip and fall. I myself have fallen numerous times. I haven't hurt anything. I just have a lot of bruises on me from when I have fallen. And I think I will try to show you all how I walk and what it looks like to have foot drop. Some foot drop is worse than others. Mine isn't that bad. Some develop really bad. And usually with the foot drop, since you're trying to compensate for the lack of the use of your right leg, you can get a lot of pain on your left leg because you're trying to compensate for what actions you don't have, what use of your right leg you don't have. You try to compensate for that by using your left leg a lot. So I do have a lot of hip pain, nothing that shows up on a CT scan or an MRI, but I can tell that it hurts, sometimes when I have to overcompensate for the lack of movement of my right leg or my right foot. So I developed that. I do have a brace for that, and we will look at that and get into that. I haven't had it long. I've probably had it for about 3 months, and I do wear it sometimes, but other times, to me anyway, I don't want to, it kind of connects around. I'll show it to you and then we'll discuss that and why I don't really wear it a lot. But I do use a cane now. Around the house, I don't use my cane because I can kind of maneuver. But when I'm out and about and we may be walking for a while or a long distance or in a crowded area, I will use my cane because, like I said, I do have a very unsteady gait. Even with my cane, I still have an unsteady gait. So I have to try to make sure I don't run into someone or fall over into someone and all of that. You just have to laugh at it because, it is what it is. It's your life. What are you going to do? If you cry about it or feel sad about it all the time, you're going to be really depressed. And I have been through depression before, dealing with all of this. But, you just have to put your faith in God and let it move from there. So I just trust in God that everything is going to be okay, that he's not going to put more on me than I can bear. And like I said, I've been dealing with this for 20 years. So he hasn't failed me yet. But so with all of those issues and the unsteady gait and people thinking you're drunk or you might be on drugs because of the way you walk and you're running into things, walking into things, falling over and all of that. But you just have to do the best you can with what you have. I don't have a true diagnosis of what all of this is other than the polyneuropathy of the peripheral nerves. So that means I have dual nerves that are misfiring or not communicating the way they should. And most of mine are in my lower legs, my lower body. Now I have had an EMG, and I'm just going to look over here to my computer because I have it all written down, which is the electromyography, and it measures your muscle response or electrical activity in response to a nerve stimulation of the muscle. So what they do is they take a needle and they stick it into your muscle and they give different vibrations through that muscle. Now, if you've never had this before, just imagine it's not a big needle, it's a thin needle, but when they're going straight into your muscle, it is so painful. There is no sedation for this. There is no numbing for this. They just go straight into the muscle. And they can't sedate you or numb you because they have to see how your muscles are going to react or how your nerve is going to react. And they do hit nerves sometimes. And oh my gosh. I don't even want to remember it. But I've had 2 of those. The first one they said was normal. I didn't understand why it was normal because they said the numbers were off. But okay. Stay on top of your doctors. The second one was abnormal. So that's when they finally said that I had polyneuropathy of the peripheral nerves. Now they stuck the needles in the back of my thigh, my lower back, my thighs, the back of my thighs, and then around my lower leg, the front and the back, and also in my feet. That was so painful. But it did finally give me some hope that one day they will find out what is going on with me and what is causing all of this, because like I said, all of my tests had come back abnormal. We, as the doctors and myself, were pretty sure that I had MS, multiple sclerosis, because all of my symptoms pointed to that. But since I had no lesions on my spinal cord or my brain, they said I didn't have it. Now, the information on MS says that 5% of people with MS have no lesions on their spinal cord or their brain. But because of, I don't know what you would call it, the medical AMA guidelines that they want to see those lesions before they diagnose you with MS. They don't want to misdiagnose you because so many things mimic multiple sclerosis. So that's where I'm at. That's where I'm stuck at today. Right now, I'm just taking, I don't take anything like Neurontin or Lyrica or any of that, since I had so many problems with those medications. Right now, all I take is mainly a muscle relaxer, and I only take maybe a fourth or a half of it because the medicine that I have is actually scored, so I can take either a whole tablet, half a tablet, or a fourth of a tablet. And that's what I do. It doesn't really help the pain, but it kind of helps me to relax a little bit, relax my muscles, and I don't know, maybe it affects my nerves some kind of way, but not really much help. Also, I forgot to tell y'all, if you see me licking my lips a lot and all that, I do have dry mouth, which was one of the symptoms that I developed. So what I have been using is this biotin to kind of help me moisturize my mouth and not be so dry. There's other little things you can do to kind of help yourself through some of these symptoms. Not much when you have chronic pain or anything chronic that you're dealing with. It's not really much you can do. Sometimes they say you can try some yoga, something like that, some meditation to kind of help you. I've tried exercises. I worked out. I went to a physical therapist for 3 months to see if I could get some function back in my legs, because like I said, the foot drop was real pronounced, but none of that helped me. In over 20 years, I think I've tried just about everything that they offered me to see if we could have any help with anything that I was going through, but none of that seemed to help. I am hopefully going to a different neurologist maybe in a month or two, once my doctor gets the referral and everything taken care of and they give me a call. So hopefully I can get some answers. Now, I have thought about going to the Mayo Clinic. We haven't quite decided on doing that just yet because I don't know. Who has the money to fly out there? I don't. I live in Louisiana. I think the closest one is Florida. They have one in Minnesota, but that's where we're at right now. And I just try to deal with everything, like I said, day by day, hoping that one day we'll find out exactly what is causing all of this, exactly why I'm going through all of this. I do have really bad insomnia, so some nights I'm up till 4 or 5 o'clock in the morning. Don't know if this has anything to do with what I'm going through. But I do have really bad insomnia. I do take something for that. It does help. But I don't know, just dealing with a chronic illness, like I said, can be very, very draining. When I was working, that kept me busy, so my mind wasn't staying on it as much as it is now. But I have pulled through some really bad depressive states. Like I said, I just leaned on God, read my Bible, prayed, trusted in Him. My husband helped me through a lot of it because he is a very faith-filled man. I have my children and my grandchildren, which is one of the reasons why I couldn't afford to give up, because of my grandchildren, so I couldn't do that. But, so I'm saying all of this again to say this: take care of yourself. get the help that you need, whether it's mental, physical, emotional. Get the help that you need. If you can't lean on your family members, seek professional help. Whatever helps you to get through what you're going through and what you're dealing with. So that's the end of this video. I will show you all my brace and everything and the way I walk with it and all of that in the next video. So if you're interested, please like, comment, and subscribe, and stay tuned for our next part of this series, dual peripheral neuropathy of the Please join us for the next part of this series, polyneuropathy of the peripheral nerves. If you have any questions, please leave them below, any comments. And like I said, please like, comment, and subscribe. Thank you all. Have a blessed day. Bye.